PI of the CEI Sexual Health Center of Excellence in Rochester, New York, and I am here in Arlington, Virginia with my colleague, Dr. Natalie Leblanc from the School of Nursing at the University of Rochester. We are both attending the SYNChronicity 2026 conference that is sponsored by Health HIV, and Dr. Leblanc gave a talk a little bit earlier about doing sexual health education through simulation. So she's agreed to just fill us in a little bit on that. So can you just tell us a little bit about what you did?
Sure. So this project was a sexual health simulation project at the University of Rochester School of Nursing. We have a simulation lab. I'm not sure if that's the right term, but we're also accredited, international accreditation for simulation. And so I approached my colleague, who's the program director for the simulation program at our school, Dr. Eric Baylor, and asked if they would be willing to do a simulation on sexual health. And I thought that was important because in my research, I research healthcare provider perspectives and praxis, HIV prevention, treatment, and care, but also sexual health and wellness with HIV embedded as an anti-stigma approach to HIV. And so it turns out they were very open. They had already been thinking about doing a simulation that involved gender dysphoria, and I wanted to bring in other aspects that we find in our literature and our research that affects HIV and sexual health and wellness. And so it was a year project funded by the School of Nursing. We have something called the Cleaner Award, and it's meant to facilitate synergy and collaboration between the education mission and also our research mission. We were able to build off of the simulation activities that were already included, but also there's a research component which required regulatory oversight to some extent. And we're at a point now where we're disseminating findings. We hope to be publishing in the next couple of months, and yeah.
So I was fortunate enough to attend the talk, and I was really interested that you picked 3 different simulation scenarios that are 3 common ones that we come across in our sexual health clinical care. So maybe just sort of outline what those 3 scenarios were that you brought your students of simulation into.
Sure. And so I want to note, though, the simulation are for graduate students. So these are masters in nursing students, meaning that they have some type of prescription authority. So the first scenario revolved around same-sex male couple. The idea was for students to engage the couple, and couples are self-defined. And in that engagement, offer an HIV screen. The couple ends up being serodiscordant, which is not uncommon, and offering PrEP for the couple member who's not living with HIV. So really the idea is that they're thinking about what can the couple be offered, also communication that's non-judgmental, that's shows kindness and awareness, but also ensuring that patients get what they need. The second scenario focused on a female college student who presents wanting an STI screen, but also ensuring that she's offered pre-exposure prophylaxis. Getting a sexual history. In the scenario, we did include that she had multiple partners, and sometimes there's some providers who kind of take issue with that for whatever reason. And again, use of non-judgmental language, also ensuring that, again, this female patient gets what she needs. The other important piece to that scenario was the offer of pre-exposure prophylaxis for HIV. We know that there has been a slow uptake for PrEP among women because there is a perception that it's only for men. And so that was one of the main outcomes that we wanted to see with that scenario. So the third scenario focused on gender dysphoria among an adolescent who presents with their parent. And so again, it's not necessarily to have the adolescent engage in any type of procedures or anything. It's more about communication, seeing where the adolescent is, getting a sense of where the parent is supportive and how they're, processing the, how this young adolescent is coming, to age, and supporting the parent and the adolescent with options and what their process can look like.
Yeah, so maybe we should just mention that for those in medical education or involved in training themselves, that sometimes when you think about simulation, you're thinking of those high fidelity mannequins that you're doing some sort of code or a very intensive procedure. And this is much more about communication. So you use standardized patients.
Mm-hmm.
So.
Yes, yeah. So, simulation training has definitely evolved over time. And so standardized patients are actors who are trained to engage in simulation and communication with providers in training. In this setting, it could be, providers who are already established and getting some type of service. But yes, they are trained to, once we give them the scenario, they get a sense of what is it that they're trying to convey. They do some, assessment of the student as well in terms of how they felt, in terms of the interaction. And so these are individuals who are within the university. They've undergone training. They do get compensated for their time. And for this particular simulation project, they were also compensated for participating in the research elements of the project. So they did a wonderful job. One of their main feedbacks was that for this type of simulation, because it can be highly sensitive, that it's standardized patients who have done this before. You don't want to new standardized patient with someone who has had the experience of engaging with students.
So the punchline, if you will, was that the students had a good experience. It seemed that the standardized patients had a good experience. I was really struck in the talk that you included a quote from the student that the experience really caused them to reflect on their knowledge of sexual health and to do their own research and really pursue more knowledge about that. I think this is a valuable tool in education, not just for students, but for currently practicing providers who might be uncomfortable. And for anybody who might be watching, SYNChronicity is sponsored by Health HIV. They have said they're going to put these talks up on their website at some point, probably in the next several weeks from March of 2026. And it sounds like we may be able to read about this in a publication as well. So thank you so much for joining us for this sort of on-site quick take on your research, and thank you for pursuing this research. It's not an area that a lot of people delve into.
Right.
So we appreciate it.
Thank you. Thank you for